Welcome to the webinar, Exploring Social Determinants of Health. I'm McAllister Ross-Mira, the Director of Operations for the John Rex Endowment. We are thrilled to have over 100 people joining us today so that we can share what we've been learning. Last year, the John Rex Endowment commissioned the North Carolina Institute for Public Health to complete an assessment and online story map to describe how conditions in Wake County can affect children and their families' health and well-being. We believe the assessment and story map are great resources that can be used to verify, validate, and learn what assets and challenges families and children face every day. The John Rex Endowment Board and staff will use these tools to help inform our decision-making throughout our strategic planning process. Thank you for attending today. We are so pleased to share what we've learned and hope that the community can benefit from this valuable information to inform programs and planning. Now, I'll turn the presentation over to our facilitator, Janine Herrick.
Good morning, this is Janine Herrick. I'm going to talk to you a little bit about our agenda today. Please keep your mics mute, and we'll mute them for you mostly. And I just wanted to let you know that you can post questions in the chat box, and we will take opportunities throughout the webinar to select a few and answer them. The webinar will be recorded and will be posted to the John Rex Endowment website. I'm going to talk to you a little bit about what we're going to cover today. First, we're going to give a brief overview of the assessment that the North Carolina Institute for Public Health conducted for the John Rex Endowment. Then we're going to talk about the development of the story map, which we're going to give a quick demo of today, and the development of an asset map, which we will also demo. There were several components to our assessment. It was an iterative process, and we began with developing the story map and looking at what different social determinants of health indicators might be impacting vulnerable children and families across Wake County. After that, we developed an asset map to show where there were structural and helpful assets across the county that were already in place. With input from the John Rex Endowment, we then reached out to 27 different organizations across the same 4 domains that the social determinants of health story map also covered. Those are economic and work, education, neighborhood and physical environment, family and household. Based on the information that we collected, we then reached out to 9 additional community-based organizations to gain their perspectives. We did an analysis of all these interviews and identified priority themes. For today's purposes, we're going to focus on the development and what we found in the development of the story map and the assets maps. Now we're at the part of our assessment where we're trying to disseminate some of our results, and you'll see on the John Rex Endowment's website we have an executive summary and a link to the story map and the user guide. The story map can be used to learn about indicators on the neighborhood level, but also to look across the entire county by different indicators. And we just want to note that this is a snapshot in time. Part of the reason we conducted interviews was to help us understand which indicators might be changing now and in the future. So this is just one point in time. So just to give you some context of what we learned and kind of where we're starting from is this is sort of the lay of the land. There's about 249,000 children in Wake County, and the ethnicity and race of these children are just over half being white, 22% identifying as Black or African American, and 15% as Hispanic. when we speak about vulnerable families, we're talking about the fact that across the entire county, 33% of families are living in poverty. And you'll hear us talk about the high opportunities for positive change. And these are some of the neighborhoods that have been discovered through the story map process as having opportunities for potentially discrete investment and intentional ways of reaching out to 15,000 children that live across 14 neighborhoods that have been chosen. But again, I want to remind you that we also looked at indicators across the entire county. So there's two ways of looking at this information. And now we will begin talking about the development of the social determinants of health story map.
All right, thank you, Janine. First of all, I just want to make sure everyone can hear. So please type into the chat box to make sure that you can now hear me. All right, thank you. That's good confirmation to have. So again, apologize for the hiccups at the beginning. We're in a couple different locations, and it's flu season, so you got to kind of be flexible this time of year. But thank you again for joining us. And so I'm going to take the rest of the time to talk about social determinants. I want to walk through the process that we went through to select the indicators and talk about the story map that we created. I'll probably do that with a live demo and then also demo the asset map. And we'll have plenty of times to ask questions throughout the presentation. We'll pause every 30 minutes or so. And so feel free to chat any questions you have into the chat box. So why are we here today? Why are you interested in this? Why are we all interested in this? Because we know that the conditions in which people live, work, play, and worship have a wide range of health effects and affect quality of life. So we love this image from the CDC because it shows, graphically what healthy roots and what the unhealthy roots can lead to. So, poor health outcomes are the result of, quite often environmental factors, other things that access to care, access to healthy food, access to recreational opportunities, things that are, pretty far upstream, but things that we can work on. So this is just one social determinant of health framework. And we like to look at these frameworks because it helps us to figure out, well, how do we start to address these complex issues? The Kaiser family has another framework we like to refer to as the buckets and bins. They break these different indicators into categories like economic stability, neighborhood and physical environment, education, food, and show that they all affect health outcomes. Another good one is the Bay Area Regional Health Inequities Initiative. And I really like this one because it shows these things on a continuum. So all of these things, all of these indicators affect our health, and it also recognizes that moving far to this side into the social inequities and institutional inequities, this is very upstream and emerging public health practice. But we use these frameworks to come up with a process to select indicators. We started with looking at the literature, looking at what other people around the country have done. What we have on the screen now are some of the more prominent examples. The California Disadvantage Index was done statewide in California. Recently, it's being updated, and it included about 27 indicators. So we got some good ideas from them, what they've done, Health of Boston Children, Children Opportunity Index, School-Based Health Alliance. These were all other social determinant of health mapping efforts that we looked at to see what they had done and came up with a list of about 40 indicators. Ran those by subject matter experts in both children's health and in Wake County data. So we were very grateful for their support. Wake Long Range Planning was very helpful in reviewing all of the things that we wanted to map in Wake County and helping us to figure out what was possible and sharing that data with us. And then we shared that list with the staff of the John Rex Endowment, and based on their feedback and based on reliability assessment that I'm going to talk about next, we whittled that list down. The data was sourced from a variety of places, but mostly it came from, mostly we rely on the American Community Survey, which is a US Census product. We use the 2015 data, which is a 5-year average from 2011 to 2015. It was just updated this December, so now there is American Community Survey data for 2016. We use the ACS for 9 of our indicators. The US Department of Agriculture has food desert data that was recently updated in 2015. We relied on that for 1 of our indicators. And then, as I mentioned, we got some really good local data from Wake Long Range Planning, and that included important community services and geocoded data from the state on the location of high quality childcare centers. And I'm going to spend a lot of time going through all of these indicators, but for now, I just wanted you to know that these are the main data sources. So one thing that we took time to do and we think is very important was to do a reliability assessment. And one thing I can say, not just about this, but this project, but any time you're presented with a number, you should always be skeptical and try to understand how reliable that information is that you're being presented. The graph on the screen shows that, sure, that bar in the middle is right. It's not the highest, it's not the lowest, but that error bar indicates that it could be the highest or the lowest. So when you're presented a figure, you should always know that sometimes there's error associated with it. So we took the time to look at the error associated with each of the indicator values countywide, but then also geographically. So in certain instances, sometimes the information that the census has gathered in some neighborhoods is going to be highly reliable. And then for this same metric, if it's unemployment or poverty, it's going to be low reliability. So we took the time to kind of go through each one of those. But that was only for census data because the census publishes a margin of error, and we could calculate a coefficient of variation, which translates to a reliability. And then we publish that reliability for every social determinant of health indicator that we mapped. So this is a way to make sure that we're presenting information that you can make informed decisions on. And going through this process, we had to eliminate some indicators. So we had to make some compromises. For example, unemployment is one that social determinant of health that is always cited and often used, but when you look at it closely, it was one that countywide, the median margin of error was 57% of the estimate. So that means that 1/3 of the neighborhoods or census tracts we looked at had a low reliability. So knowing that unemployment could maybe be, we could find other proxy variables like income, we decided to leave that one out. So we went through this process to whittle down the list of 40 basically to a reasonable number. The other thing we did was bin certain indicators differently. So you often hear of a social determinant of health indicator of those with less than a high school diploma are at a higher risk for poorer health outcomes. However, it's actually a fairly small percent of the population. Maybe in Wake, I think the average is, I think 92% of the population have at least a high school diploma, so it's a highly educated population. So getting information on that 8%, it can be tricky. So we just inversed it. So we are mapping areas where people have at least a high school diploma. So same thing with school enrollment. We want to know about all ages of school enrollment, but we know from evidence that early childhood education has some of the greatest impact on quality of life outcomes. So we would have liked to just look at ages 3 to 5, but again, that's a small population. The reliability of those estimates wasn't great. So we binned it to all ages. So we had to make some compromises because we wanted to present the highest quality information. So we took after we went through that reliability assessment process, in looking at subject matter expert advice, speaking with John Rex endowment staff, we came up with 12 indicators at the neighborhood level. So you'll hear me say neighborhood and census tracts interchangeably. These are census areas that are probably not necessarily recognizable neighborhoods if you live in Wake County. They don't have neighborhood names that you would know. They're listed by number, but it's the way that the census collects this information. It's the only way that we have this type of information collected reliably. There are 187 census tracts in Wake County, 185 with populations. There's 2, Umstead Park and RDU are, that you'll see in the maps, kind of open areas that no one lives in. So that was our unit of analysis. There are smaller units of analysis. I'll show some later in the presentation, but we wanted to make sure that the information we were presenting was the most accurate. So we took those 12 indicators and put them into a interactive web map, which is what this session is about. We'll go through this in detail. And finally, we created an index to summarize all of the indicators into a single variable. So this was important because it allows you to hone in on specific areas that have the highest disparities, but it also kind of gives you that summary overview for all the social determinants. And I'm going to go into that in more detail as well at the end. Okay, I think that's good for that. So I want to take some time now to talk about how to detail exactly what indicators we selected to clearly define them, to talk a little bit about why we included them, why we felt they were important, and then also what other indicators we considered that were either low reliability or other indicators that the ones we selected are proxies for. So this is our social determinant of health framework. We have 12 indicators, 3 in each one of these domains: economic and work, neighborhood, physical, family, household, and education. I'm going to go through each one of these now. For economic and work, we chose family poverty, households receiving food stamps or SNAP, and uninsured individuals. Now, what we mean by family poverty is the percent of families with children under 18 years old that are below 200% of the federal poverty line. Now, we chose 200% because we know that Wake County is an expensive place to live in certain areas. So this better accounted for the higher cost of living. We also considered individual poverty as an indicator, strictly child poverty, and then, as I mentioned earlier, unemployment. The next indicator in this domain was food stamps or SNAP. And so again, what I mean by that is the percent of households receiving food stamps or SNAP. And SNAP eligibility is determined by poverty levels, but you have to be between 130 and 200%. And there's also a resource test, which gets at whether or not there is any money in the bank, essentially. Other indicators that we considered were public assistance rates, cash SSI, strictly children instead of households receiving SNAP, households receiving housing assistance, and then free lunch percentages. So for each of these, they had their drawbacks that made us lean towards food stamps and SNAP over others. The public assistance rates, the reliabilities were too low. Children receiving SNAP, again, were too low. Housing assistance, similar, and then free lunch as well. So the final indicator in this domain was uninsured individuals. So for this, it's the percent individuals without public or private insurance. And we know that insurance is important because it provides financial stability and access to preventative care. We also considered including uninsured children, but again, this was a small numbers issue where the data just was not reliable consistently across all neighborhoods. So we went with uninsured individuals because we know how much the health of how the health of parents can affect the health of children. So our next domain that I want to walk through is the family and household. We looked at crowded households, high housing costs, and single-parent female-headed households. When I say crowded households, this is a census definition and one that lots of people rely on, and it means if there are more than one person per room. So if you have a household with 4 rooms in it and you have 5 people living in that house, that is considered a crowded household. We know based on what other people are, a lot of people rely on this indicator. It's an indicator of severe housing problems. The School-Based Health Alliance is one that uses this, and they are focused more on school-based health, as you might imagine, but they have developed a similar tool, and they were one of the systems that we analyzed at the beginning to see which indicators to include. One thing I will say about this one is that it is a low numbers issue. Only 2.5% of Wake households are classified as crowded, so that's roughly 10,000 households out of the 370,000. But we felt like it was important enough to include because it's one measure of the housing conditions. So the other measures we considered were lack of complete plumbing or kitchen facilities, which you might think, there aren't any houses like that in Wake County, right? But there are, thousands in fact, but not nearly as many as crowded households. So these are kind of proxies for each other in a way. So the next indicator we looked at was high housing costs. And what we mean by high housing costs are households paying more than 30% of their income on rent or mortgage. We know that in high housing costs can often lead to frequent moves, poor health, behavioral, academic problems in children. This is according to Robert Woods Johnson Foundation. And we did consider other indicators. We looked in the past, we've done similar mapping, and we just mapped percent renters. But we think this is a better measure, a better indicator of the burden that can be experienced. We also thought about mapping cost of living, but that is not an easy task, and it wasn't something that we could accomplish as easily as just relying on this figure. The final indicator in this domain was single-parent female-headed households. So this is the percent of families with children headed by females. RWJF also uses this indicator, and they have said that these types of households are more likely to be food insecure and living in poverty. We also did consider just straight up single-parent households, not female-headed, so that would be male and female-headed households that are single parents. But we know that there are far more single mothers than single males, and that there are about 7% of the households in Wake are headed by single moms. The next domain I want to run through real quick is neighborhood and physical. So for this one, we selected 3 indicators: low access to healthy foods, access to community services and resources, and income inequality measured by the 80-20 ratio. So when I say low access to healthy foods, what we are relying on for this one is the USDA food desert data. Now, the USDA defines a food desert as low-income neighborhoods with low access to supermarkets and low vehicle access. But since we already included low-income neighborhoods, we already included family poverty, we only used USDA data that indicated which neighborhoods had low access to supermarkets and low vehicle access. Low access being defined as more than 1/2 mile in urban areas or more than 10 miles in rural areas from the nearest supermarket, supercenter, or large grocery store. No vehicle access are those households that do not have a vehicle present. And in Wake County, there are 16,000 households without a vehicle. One thing to note is that the USDA does not publish reliability on their estimates, but it is the best data that we have for, at the moment, food access. The next indicator that we included was access to important community services and resources. So this we calculated as a density measure of the following community services on the screen. So we looked at, where are the pediatric offices, libraries, fire and police stations, public parks. And this came directly from Wake Long Range Planning. They have a layer called Places of Interest. And we calculated a measure that is the number of people served by each resource. So if there were 100 of these important community services in a census tract and 1,000 people, then we can say that roughly each service serves 10 people, as an example. All right, the final indicator in the neighborhood domain was income inequality. So income inequality is calculated as the ratio of income at the 80th percentile to income at the 20th percentile. So on the screen, I have a couple examples. So if the income in a tract at the 80th percentile is 500,000 and at the 20th percentile, it's 50,000, we would have an income inequality ratio of 10. So that means that people at the 20th are earning, or people will say people at the 80th percentile are earning 10 times as much as those at the 20th. So you could also think of that as the top 20% or bottom 20%. The other example shows a little bit more parity, so less income inequality, 100,000 in the top 20% and 50,000 in the bottom 20% gives you just a ratio of 2. A little more context, in Wake County, the county-wide, that inequality ratio is 4.3. In North Carolina, it's 4.8, and nationwide, it's 5. So you might think, oh, okay, well, Wake we're fine. Our ratio is actually pretty good. But there were areas where it is as high as, I think, 14. So there are certainly, it's a localized effect that I'll show you on the map here in a bit. So why do we worry about income inequality? This is something that is being, more and more people are paying attention to. It has broad health effects, social stress, loss of connection, sense of community. And both the Opportunity Index and RWJF County Health Rankings have incorporated this into their systems.
Matt, I'm just going to take a moment. I'm going to take a moment to take a question for you about the selection of indicators. And if anyone has additional questions, please type them into the chat box. The question we have is, for the crowded housing, is that total rooms or bedrooms for counting? And Lynette, if you could type the answer in the chat box after you hear Matt respond, I'd greatly appreciate that.
It is the total rooms. The graphic shows beds, but it is the total rooms in a house. Okay.
And I see another question. For education, you use school enrollment ages 3 to 18. What is included since 3-year-olds are not in school? And again, Lynette, if you could type the answer, thank you.
preschool. I mean, if it's any type of enrollment, if you send your kids to any type of essentially daycare at that age, I think that's considered school enrollment. I'd have to look into that further though. The census breaks it down into age categories, and 3 to 5 is the age category. So it's probably kindergarten is age 5. So yeah, I think it's probably measuring preschool enrollment. Any other questions for now? We're got one more domain to go through, and then I was going to pause before I did the demo. All right, I'm hearing nothing, so I think I'm going to carry on. So the last domain is suitably or appropriately education. So in this domain, we looked at access to high quality childcare facilities, school enrollment, ages 3 to 17, and individuals with at least a high school education. So access to high quality childcare facilities, we knew we wanted to get at this measure. We know that access to high quality childcare, there are measurable outcomes. And what we mapped, what we settled on were 4- and 5-star facilities as measured by the North Carolina Division of Public Health. Next bullet here, Division of Child Development and Early Education. But we know this doesn't tell the complete story. So just because your kid is not in a high quality 4- and 5-star accredited facility, I mean, there's certainly other childcare is very important as well. So if it's a 1, 2, 3-star, at least it's a facility. So we know there is a limitation of using this as an indicator, but we wanted to map the highest quality available. And we know that there are about 311 of those in Wake County. And we did look at possibly including 3 to 4-year-old enrollment in some type of preschool. But again, those numbers are really low, poor reliability, so we decided to use access to high quality childcare instead. School enrollment was the next indicator. We looked at the percentage of all children enrolled in school between the ages of 3 and 17. Looking at all the ranges like this together provided more variability and reliability of the estimates. So what I mean by that is when you just look at 3 to 5, there's not a lot of variability in those estimates. It's a small percent, or it's and then the estimates themselves are small numbers. So it gave us essentially more chance to differentiate areas. We would have liked to look at test scores, reading and math levels. That would be ideal. But that information is collected at the school level, and we could extrapolate that back to a school district, and that is what a lot of other people have done. But to us, that is misleading, especially in an area where you might not go to a school nearby you, like in Wake County. You might be going across the county. So assigning those values to a school test scores to the neighborhood that it's nearest would be misleading. So we looked at just simple enrollment. High school education was the other one. So individuals includes people who receive a diploma or GED. We know that low education is closely linked with poor outcomes, poor health outcomes, and we did also consider maybe associates or higher, since Wake County is a fairly highly educated population. But in the end, we settled on this one. And as I mentioned earlier, looking at less than high school education, that information leads to a lot of low reliability estimates. So we did the inverse. So after we took after we settled on our 12 indicators, I mentioned this earlier, we wanted to kind of roll all those up into a single value, and that was this index. To do that, we calculated z-scores. This was a way to standardize the values and then combine them. We equally weighted all 12 indicators, and essentially what the index score is, the z-score, is a measure of how far above or below all of the indicators in that neighborhood are from the county average. So the strength of taking this approach is that it allows you, it's a weight-specific index. There are other indexes like this available, but they're often going to compare your neighborhood back to the state, not to the county. So this was a good approach for us to take. And the numbers on the screen show the top 10 values. And I'm going to spend a little bit more time on the index towards the end. So this is where we can pause for a minute before we switch gears into the live demo. So if there's any other questions about indicators that we selected, why we selected them, how we define them, this is a good chance to interject.
Hi, Matt. You have a question in the chat box.
Mm-hmm.
How did you account for homeschool?
So the variable we used is enrollment ages 3 to 17, 18. I can't remember now because I think I might have seen 3 to 17. And it's a census question. So it's essentially, that's a good question. Actually, I'd have to look into that because it's a question that the census would ask, is your child enrolled in school? I'm not sure how the question is worded, but I would imagine it's included because I'm guessing that the question is probably worded more like, are they enrolled in some sort of curriculum, not do they physically go to a school? But that's a great follow-up. That's a question I do not know the answer to. Any other questions before we roll on? Okay. So I think we got some of the questions earlier. So what I want to do now is switch gears and show you what we created. And we're going to have lots of time to go through this. Again, lots of time for questions. Feel free to chat them at any time into the box. And you can follow along if you'd like. The link at the top of the screen is a link to the story map that I'm going to click here in a minute. And what I want to do is just walk through the basic navigation of the story, how we set up the chapters, simple functions that the story map allows, like zooming around, interacting with the map. And then I want to share some interesting findings that we found along the way. And if you want to follow along, feel free. If you want to follow along at a later time, the guide at the bottom of the screen is a user guide that will essentially cover everything that I'm going to talk about now, minus the interesting findings. So with that, let's switch gears. I will say that the browsers that you use will have different functions. So if it's kind of not operating the way you would like, give Firefox or Chrome a try. Internet Explorer may not work as well, but it might be just fine. All right, so when you click on the map, it's going to redirect you. This is a tiny URL, and it will redirect you to the story itself. And the way that the story map is set up is that we have the different tabs at the top, which you can select. These are the domains that I just went through: economy, education, neighborhood, family, household. Putting it all together is the index. And I have not talked about the asset map at all yet. That'll be the last 30 minutes or so of the presentation. Within each of the tabs, you have the panel that you can scroll up and down in that gives a little more background on the process that we went through. It also includes this graphic that I just went through with the chapter numbers at the top, with the indicators within each one of the chapters. as a guide for you to reference back to. Again, if you forget this, most of the census data is the 2011 to 2015 average, 5-year average from the American Community Survey. So keep that in mind. So when you're on the screen here, you have 3 buttons, very limited amount of information or tools that you can do to begin with. If you click on the screen with the left mouse button, it'll allow you to drag and pan. If you roll your mouse bar in one direction or the other, it's going to zoom you in to give you more detail. There's not a lot to do on this first one, but just to kind of familiarize yourself with interacting with the map. It should operate just like Google Maps would. You can also zoom in or zoom out, and if you get disoriented, you're in the wrong place, you can always hit the home button. Okay, so now the chapters are set up slightly different. The reading pane is going to be on the other side, and they're going to have a lot more information. So right off the bat, you're going to have a legend that shows what is being displayed on the screen. So for this example, we have total population, and our bins are 700 to 4,000 is this lightest color, 4,000 to 6,000, 6 to 9, and 9 and up. So you can see North Raleigh is a fast-growing area. These neighborhoods are census tracts, and the census tries to keep them at a reasonable, or they try to keep them within a range of, I think, 3,500 to maybe 7,000. Don't quote me on that, but I do know that these big ones that are growing very quickly will likely be split in the next census. So a neighborhood that looks like this in 2010, in 2020, might look a little different. So this one, for example, will probably be cut in half somewhere to make it more reasonable. So on the tab, you can scroll down through the story, and throughout the story, you'll have just a couple buttons. It'll say show total population, that's what we're viewing now. Show population density tells a much different story. And then you can also see just the child population. So this is total population under 18. We also looked at race ethnicity. And so for this, you can see that Wake County has a very distinct pattern of where people live. And we looked at all ages and under 18. So we looked at children as well as all adults. And then we looked at these race ethnicities that are on the screen. One other thing, so before we get into some of the more interesting findings, I went over the legend. You should always pay attention to what's up here because these values will change. Dark red is not always going to be 75%. So right now that is children under 18 that identified as white alone in the census. Contrast that with Black African American children. So these numbers change, these values, these ranges change. And when you click on the map itself, you will get a identification box that tells you exactly what's in that neighborhood. It's going to outline it in blue, and then it will show you this is census tract 52816. And you can Google that, and it'll bring you to a census website or someone else's website. It'll give you lots of information about that census tract. But you're not going to tell if nobody knows the number of the census tract they live in. So this is what I referenced earlier. These are neighborhoods, but only according to the census. Maybe not if you live in this area, but it's the way that the information is gathered and tabulated. So it's what we have. So within this census tract, we know that there are over nearly 17,000 people. Almost 5,000 of them are children. And then we know that the race ethnicity breakdown. Actually, for this one, we're just displaying Black African American children. And then we also know, as I mentioned, the reliability of that estimate. So we calculated for all of these reliabilities, it's either low, medium, or high, or not determined if, let's see if this one's in there. No, it's not even clickable. So these are the two tracts that are no population lives in. So when you click on the box, this is how you get the more information, and then you can either click off of it to get rid of it, click off the screen, or you can click that X in the upper right-hand corner. All right. You might also, as you zoom in, you can see, so you might not, this might not be particularly helpful until you start to zoom in to figure out, okay, well, where is this neighborhood? And you can turn the layers on and off with the on-off button and start to get an idea, okay, here's the belt line very clearly going around Raleigh. And then if I zoom in, turn this back on, now I can start to get a sense of where these neighborhoods are. And then as you zoom in too, this maybe the legend's in the way, you can always make the legend go away by clicking the top box here. Okay, so that's basic navigation within the story map. So now I want to kind of highlight a couple interesting findings that we found. So I want to start with the Hispanic population of what we saw. So all ages Hispanic is shown on the screen right now. And contrast that with Hispanic youth. Now in this case, again, same breaks. So I'm panning back and forth, getting a message says the internet connection is unstable. So if I'm going too fast, chat into the box and I'll slow down. It looks okay on my screen, but what I want to highlight here is that these percents are the same. The ones in dark red are where 25% of the population identify as Hispanic or Latino. Now, when you look at the children, this is a much different pattern. You have some of the same areas that have the high percent, like this neighborhood, but we have a lot more neighborhoods too. So this is a shift, changing dynamic. The next thing I want to draw attention to that we thought was fairly interesting is in the economy chapter. And actually, I'm going to go ahead and pause for a second and talk a little bit about how these are structured, these chapters. So the demographics chapter is structured, as I just showed, it has has total population, and then it goes through race, ethnicity. Economy, each indicator has its own section within the chapter. So we start broadly, we describe a little bit more about all of the indicators that we included, and then we go into each of the indicators. So we start with child poverty, and then what's shown on the screen are these yellow dots indicate the number of children under the age of 18 within each one of the neighborhoods. So small dot, not many children, big dot, lots of children. Dark green, high poverty, high family poverty rates. So very distinct pattern. And if you want to get rid of the dots, you can say show child poverty only. Get rid of the legend too, so you can kind of see this a little better. But there's a very distinct band running southwest to northeast through Raleigh. So that was something of note. And then, what really caught our attention was, well, you would think since SNAP eligibility has a poverty component that these would be similar. However, we're not seeing that at all. So if we want to switch back and forth between poverty and SNAP only, you can see, again, keep in mind these breaks are different, but we have a high percent in poverty, but not the same level of enrollment, particularly some of these neighborhoods that have some of the higher poverty values. So this is 63% of families with children are below poverty here, and yet the SNAP enrollment is 13%. So something to keep in mind. The next thing I want to highlight, I'm going to jump over to neighborhood. And for this one, we started out with low access to food and transportation. And I would like to look at community services. We'll do this one instead. So one of our indicators was community services, and this again is the points of interest file from Wake Long Range Planning. And they've done a great job of putting all these things on a map, and not only doing that, but providing a lot of information about these points. So all of the blue picnic tables are all the parks, and if you select a park, you get the name at the top, and if there's a website, you can click that website, and it will take you to the, depending on what jurisdiction it's in, it'll take you to that city's webpage about the park, give you a lot more information about that park. So what facilities are there, their hours of operation, etc. So this is a great resource that they pulled together, and this was one of our indicators, was the density of these services in relation to the number of people that are there. So we've got libraries, parks, police departments, schools, train stations, etc. Also in community service or in neighborhood was income segregation. This one doesn't show as distinct a pattern, but there does show some of these areas that have some of the highest values. So this is where it goes up to 10, not 14. I think I said 14 earlier. These are the areas where people in the top 20% of the income earnings are earning nearly 10 times that of the people in the lower income. So that would be these areas that are becoming maybe built out a little bit and pushing some of the long-term residents maybe in those areas out. Okay, so let's look at family and household. So this can essentially be used as a way to start to, if you're a housing authority, for example, or if you can start to hone in on which neighborhoods are seeing some of the highest housing costs. If building or supporting affordable housing is part of your mission, then this I think is fairly useful information that these are some of the highest. These are the neighborhoods where people are paying 40% to 65% of households are paying more than 30% of their take-home on rent or mortgage. So very distinct pattern for high housing costs, and we see an overlap with this and some of the low access to food areas, which let me just switch back to that really quick. That would be here. So some of these same areas that have high housing costs also have low food access. So Southeast and South Raleigh. So the final thing I want to highlight, and I encourage you to, take some time to comb through the story itself. The nice thing about this platform is it allows you to kind of tell your own story with the data, to find, to look for patterns that are important. Maybe you're only working in one part of the county. This allows you to kind of hone in on those areas and start to get a population level sense of what's going on. And if you're interested in overall, which areas are experiencing the highest disparity. And I think the greatest strength of taking this neighborhood approach, this geographically based approach, is the ability to sum everything into one value and to identify these neighborhoods that are consistently showing the highest disparity. At the beginning, Janine mentioned 14 neighborhoods. So what we have here are what we're defining in the index as high, medium, low, or above average. And that's spelled out here. So these above average neighborhoods are better than the county average. So on average, they have higher educational attainment, low child poverty, high access to services, and lower housing costs. And then we have low, medium, or high opportunity for positive impact. And there are essentially 28 in the medium category, so that's this pinkish salmon color, and 14 in the highest opportunity. So these are the 14 neighborhoods that Janine mentioned at the beginning. And just something about these 14 neighborhoods, there's over 15,000 children living in these neighborhoods between the ages of 3 and 17. On average, 78% of the adults in these neighborhoods have at least a high school diploma, compared to 92% throughout Wake County. Nearly 80% of the households with children living in these neighborhoods are living in poverty. This is the 200% federal poverty level, compared to 33% overall in Wake. But only 25% are enrolled in SNAP. 17% of these households in these neighborhoods are headed by single moms. 50% have high housing costs, and about a third have low access to food and transportation. So one approach, or one strength of this method, we think, is to narrow in exactly which areas we might have the most impact in if we try to implement a change. So these are the areas that have the highest disparities. So with that, I think we have some questions, and I think this is a good time to pause and get some of those questions answered and open discussion. We are doing good on time. We have essentially the last 30 minutes to go over the last section of the webinar, which is the asset mapping. And that is this final chapter over here, which if you're following online, you may have already peeked into. But
Hey, Matt, I'm going to give you the first question. How do you make sense of the Latino children in areas much bigger than the Latino families identified themselves? Why was WIC participation not included?
Is that two questions?
They have two question marks, yes. How do you make sense of the Latino children? Since the Latino children were in areas much bigger than the Latino families identified themselves.
Yeah.
And why was WIC participation not included?
WIC participation, yeah, we did struggle with including that for sure. So I'm trying to think back on why we did not include WIC. We did have some of that information available. I think that our main hope was that we would kind of get at those measures through others. So poverty, access to childcare, single moms. Again, we couldn't include everything. And so we tried to make sure that what we selected were reliable indicators and indicators that others had also used. I hope that gets at the WIC concern. Janine, or I don't know if Kellen's on the line. She could also, anyone else who would like to try to address it, I think we're good. But yeah, I think it's a good opportunity. We can follow up. If that concern wasn't addressed, we can follow up directly with you on that. The pattern, the Hispanic population pattern. So the question is, how do we explain this? Why are we seeing much higher percents out here? And that's, I think that the families are just growing that much more. So this is where, all ages here. So here's another thing too to consider, is that the reliability of the assessment is low. So some of these might be data errors. We've got medium reliability here, but this is one of those areas where you see a high percent. We feel reasonably confident that this is correct for children, but maybe this should be higher for adults. So that could explain some of the larger discrepancies, but I think it's just an indication of families growing. Other questions?
Were there any conversations, concerns that this information could be used by realtors and or not for purposes intended to help these populations, but actually have info used against the very population that are intended to help?
Certainly. Yeah, stigmatizing definitely came up, and that's would not be the intent frame it as positive impact for change in these neighborhoods, but we know that there are remnants of redlining, and yeah, this is certainly a concern. But I'm not really sure the best way to handle that, because I think it's also the only way that if we want to improve conditions, we have to identify where it's occurring. So this is a systematic way to do that, to start that process.
Sort of playing devil's advocate, how do you, the areas with the greatest disparities and fewest resources, make them the greatest opportunity for impact?
Well, yeah, it seems like they might be the most challenging, but that does not mean they are not deserving of work should be done there. So yeah, the question is, why do we think these are areas with greatest impact? But if they are the areas with the fewest resources, well, I mean, that's part of the solution. Maybe there need to be, maybe those resources are there, but they're not accessible. And that is one thing we found with the high quality childcare centers that I meant to highlight. But there actually are a lot of high quality childcare centers in some of these areas that we identified. So I'll just highlight that really quick again, if you can keep those shapes in your mind, and then I can go to education and high quality childcare centers. But just because a resource is there doesn't mean it's affordable. So the question of access versus affordability comes to mind. So actually, another way to do it is to actually click on the neighborhood itself, and you get this summary. So this nice, there are, we categorize things again as above average, low, medium, or high, and daycare access here is above average. So yes, there's a ton of high quality facilities here, but are they accessible to the population that lives there? Probably not. For this one, it actually is low. There are not as many resources. You get closer to the city. Yeah, it's a good question. It's certainly a challenge. Yeah, we wanted to make sure we're framing things positively. And yep, we definitely thought about unintended consequences. It's a big concern. And yeah, so I think this is from Janine. She's saying developers are already pretty well informed in these areas. So I don't know, not sure if hopefully they won't pay attention to it. This might not be something that they're utilizing. Any other questions before we move into the asset demo? How can people add their own data? That's coming up next. All right, so I think this is a good opportunity to shift gears. So again, the first part of this map is really laid out as a story. This is the way it kind of tells the process that we went through to select the indicators and then share some of the findings that we found. The final chapter is formatted considerably different. So this is the asset chapter, and this one, it operates more like mapping software that you would use on your computer. So it has a lot more options to interact with the layers. And what I'm going to do now is walk through what all the functions of this of the asset map are. So you have the same zooming in and out, plus and minus. You can always go home, as you saw, it was somewhere over here for some reason when it started. To go back to Wake County, you can always zoom back in that way. Zooming in with the mouse wheel will start to bring in layers that aren't there. So these are, they're set to display once you get into a certain resolution. And the first thing you'll notice, again, is that the base map is gray, and you might be thinking this doesn't help me at all figure out where we are in Raleigh. So the first option you have up here is something called the base map gallery. So it's the 4 squares in the upper left-hand corner, right below the words Esri World Geocoder. If you click on the base map gallery, you will get a list of all of the other maps that you can put in the background. So what we're viewing right now is light gray canvas. One that I rely on a lot is streets or imagery with labels. So streets will give you something that maybe you're more used to looking at, starts to put, it actually has topography, that's what the shading is, and names to the streets. Something else very useful is imagery. So this, as you zoom in, the imagery starts to make a little more sense. And you can see that this is downtown Raleigh. I'm going to switch off of imagery because it does not allow for very good contrast. But do know that even the light gray canvas that I switched back to, as you zoom in, for Raleigh in particular, has the building footprints and it has all the road names. But you have to zoom in pretty far to get those. So you can change the base maps. You have lots of different options. Feel free to use the one you like the most. And you also have, yes. The next thing I want to show you are, I'm going to skip over the next tool, which says swipe. I want to talk about these next two, layer list and legend. So legend will show you what's displayed. And right now, what's being shown are the farmers markets and roadside stands and the county boundaries. So this is not particularly helpful at the moment, but what is helpful is the layer list. So this is where these are all the different layers that you can add in, or that are currently added in that you can turn on, turn off, manipulate a little bit. So highways are in here, bus stops are all over, and this is one where as you zoom out, you're not going to see those bus stops anymore. As I zoom out, those should disappear because there's just too many to display at this resolution. So as you zoom in, they come in, and if you click on the bus stop, you should get some information about that bus stop. We also have bus routes on here. I'm going to turn highways off so it's a little less confusing. And then you have the same information we just displayed in the story map. You have these dots that represent child population. I'm going to zoom out to full extent by hitting the map. I'm going to minimize the layer list. So now those are our population dots. Pull up the layer list again to see what's being displayed. I'm going to go ahead and turn these off. And you can see what else is selectable. We've got greenways and trails, farmers markets and road stands. Important community services was the indicator, one of our 12 indicators. It's gray right now, again, because it as you zoom in, it will be displayed. Points of interest is actually the full layer from Wake County Long Range Planning. So it actually has other things in there that we didn't include as an important community service, like shopping centers. Maybe we should have, but. And we got public open spaces, and then finally the index at the bottom. So you can start to recreate kind of what was in the story map, and you have all the same data that was in there. You have a couple options that you can do with each layer. You can move them around. So if you want to move up the points of interest or move it down, you can adjust the transparency. So that makes sense for the index. Like maybe we want to make this transparency so you can see through it. This is helpful when you're overlaying layers. You can also view the attribute table. That will open up all of the table, the tabular data that's behind each one of these shapes. And then if you click View Item Details, I'll show you what that does later. This will bring up another web page showing some details about this, this layer. So those are the layers that are already included, and that's generally how you interact with them. I'm going to minimize this. Before I get into adding your own data, I want to show one other feature, and that's this geocoder. So you can type an address into here, and so I tried this earlier. What's a good address in Wake County that I can search?
You can use our address,
Okay.
712
Mhm.
West North Street.
So as you type into the box, it's a world geocoder, so it's everything, all the addresses they have in the world, and there it is in Raleigh. When you select it, it will add it to the map. And you can add a marker. I don't see that option right now. But that's the JRE office right there in downtown Raleigh. All right, so this helps you locate addresses if you're just kind of maybe trying to figure out, well, where am I looking again, and what is this relative to some other known location? So the final fun thing I want to show are how to add data. So you've got, those are all the tools there. I'm going to cover swipe here in a minute, but another nice feature about the asset map is that you can add data. Now you can add data a number of different ways. You can add data that is already on ArcGIS Online. So that is what this system is built on. Or you can just upload your own data. So I want to walk through a couple examples. And the URL is the same thing if you know the web service, which you probably won't. You have to know this unique long code. That's another way to add it. It's kind of a shortcut, same thing from here. So let me do the file option first. So you can add a zip file, a table, if you have a table with latitude, longitude, or XY coordinates in it. KML are open source mapping files, GPX or GPS files, and GeoJSON is another option. So I'm going to see how this goes. I'm going to browse for some data that I already downloaded. So I took these from the Wake County GIS data website, the school boards I did, and then medical facilities. This comes from the NC1 map, is a source of lots of statewide data. And they have a layer called medical facilities that was published in 2003, so it's fairly outdated, but it's a good example of uploading some point data. So for this one, this is, if you're interested in where the Wake County school boards are, you just select it, and then now we have Wake County school boards on the map. What you can't do is change how this is displayed. So it gets put up here, and that's how it's displayed as a blue. And so if you want to change the transparency, you can. But where it kind of comes into, to make this a little easier to see, you can start to use the swipe tool. So we've got now the Wake County school boards in here. Let me identify that and look. So this one is Roxy Cash's school board. Not a lot of information in here. What's this? Yeah, okay, so that's how we add a marker. So not a ton of extra attribute information associated with that school board, but at least lets you know the boundaries. If it's hard to view, you can use the swipe tool to select whichever one you want to swipe, and this basically turns that layer on and off, so you can kind of go back and forth to see, okay, well, where the neighborhoods are within the school districts or school board districts. Let's go back to this. So now maybe I want to add some more data. Those are shapes. Maybe I want to add some points. So this added 401 features from, again, the medical facilities database, and they are all displayed the same as these orange dots. And let's look at what, oopsie. So if I ID it, you'll see it's coming up with this medical facilities Wake, and then if I hit the arrow here on the right, it's going to show all those attributes. So this is a mental health home, and then it's got the phone number, and again, this is slightly outdated data, but I just wanted to show you how this looks to add your own data. Once the data is added in, you might want to get rid of it. If you click that layer button there, right here in the lower right-hand corner, that will show you what data you've added, and all you have to do is just say remove layer. Anything that you do within a session, again, keep in mind this is a browser, you can't save what you've done. And that's kind of a limitation of this particular platform. But if you write down the process steps that you go through to add it in, I think it can still be fairly useful. And you know, it's very fast to add the data in if it's already formatted. These particular data files are zipped shape files. So this says shape file with a zipper on it. That's probably the easiest thing to add in, and that's how most geographic data is stored. I want one more thing I want to show is how to add data that's kind of already out there. So you can search all of the data that's been publicly shared on ArcGIS Online, and it has these functions to only search within the map. Because I'm signed out, it doesn't let you search within your organization. So if I just search Wake, oops, wrong. If I search Wake here, it will bring up all of these different data sources. So a lot from Wake County government. So they have tax parcels in there. I don't know who this user is, this feature service, but they have a lot of stuff. Greenways, that's not very many greenways though. Planning jurisdictions are in here, so if we want to add those in, it's a matter of clicking add. Let's see, what would be something interesting? A specific zoning for areas, you can add that in. Highways we already have, so these are kind of slowly coming in. Some of these are pretty large files. So then once they're in, the same thing if you want to remove them, you can just click remove here. So once they're in, you can look at it and see what it is. This is the zooming file, the zooming layer for Wake Forest. So you see some information there, general residential zone. Let's see, how can I find, let me just look through these some more. So we've got 375 items essentially. One thing that I wanted to share is that, you know, we aren't the first to approach this type of work in Wake County. So I mentioned Wake County Long Range Planning. Sharon Peterson and Bill Schrar have been working on this type of information. They have an atlas that they've published, and it's on here. If I can remember how to find it, it'd be great. Apologize, I forgot to write down. I wonder if I can search that. Yes, okay. So because I know that Bill published this, I can search explicitly for the index that he's published. So this is something that he published in 2015. It's similar to what we've done. We go ahead and try to simplify things here. Turn off Wake zoning, turn off the facilities, turn off the farmers market, to where we're only looking at the index and the what Bill's group has created, the community vulnerability index. So for this, they looked at a smaller scale. And this is where the swiping is really helpful. So they map at the block group level. So you can see that these shapes that I have, so this big one I'm queuing in on this one right here, is actually split into smaller neighborhoods. They're called block groups. So, you know, we might be identifying this entire tract as having these values, but really it's associated with some smaller areas within it. And even with this one, you've got some of the higher values. So what they mapped, that's mine. This is what they have, their index. So they looked at poverty, no high school diploma, unemployment, percent vacancy, under 18, over 65, average dependent, I'm not sure what that is. So they looked at quite a few variables, similar variables at a smaller scale, and this was, so you can see some overlap. And so I think that's interesting, but it's nice to be able to add these other layers. Only limitation here is that you can't manipulate these. So it's basically however they published it. I can't change how these are displayed once they're in here, but you do have less vulnerable to more vulnerable. If you want more information on that, feel free to follow up with me or with Bill in Long Range Planning. So we only have about 5 minutes left. So I want to take a pause now to think if there's any other information, any other questions we have. Now's the time.
There are a few questions in the chat box, starting with Adams.
Great indicators and good data. Is there any intention to link these to health data? Yes, wouldn't that be great? For example, access to primary care physicians, number of EMS calls, visits, Medicaid enrollment, prevalence of diseases. Yes, I think that is clearly the next step would be to tie these to actual outcomes. It's not something that we are currently working on there. I think there's a statewide effort to start to look at some of these things. I'm not sure what that timeline looks like, but yeah, that is I think definitely needs to be done. Kate would like to ask what geographic markers need to be included with your data in order to be mapped. So you can take a screenshot. So you can include, if you do want to capture what you've added here, you can take a print screen, and that's the easiest way to save what you've done. I'm not quite sure I understand Kate's request, though. I think what she means is in order to add your data to this, what needs to be included, and that's an XY coordinate. So either latitude, longitude, decimal degrees, however that's formatted. If that's in a table format, you could try that. But the easiest thing is uploading a shapefile. But if you don't have the mapping software, you can't really do that. So I think it's putting it in a table and clearly stating an XY. And you can get that from Google if, so is it on the screen? Yeah, so when I say coordinates values, that's what's down here. -78 is our X, correct. We are -78 degrees from the prime meridian and then 35 degrees north. So you could get some of those from the map itself. So as you hover over the map, these all right. Any other questions? We did not have any particular health outcomes in mind when we selected the indicators. No. The question is, did you have any particular health outcomes in mind? And we wanted to be as broad as possible. We did not select health outcomes to begin with. We were looking at all upstream factors that might relate to vulnerable children and families and health and their well-being.
2 more questions in the Q&A. One from Robert. I'm imagining the endowment is hoping that its future grantees will use these data for their funding applications.
Well, the answer to that, how I would answer that question is to say that we commissioned the Institute to do this work, to assist us in our strategic planning work. That was our original intention. I think what we have found, as evidenced by this webinar, there's a plethora of information that we certainly hope the community uses as they do their planning and work on a regular and ongoing basis. So yes, I think the recognition that this is very valuable information that can be used by many different organizations throughout the county.
One last question, and I think we'll be done. What are the requirements for adding CSV files to the map?
Yeah, so that's I think that's what Kate was getting at too. The requirement is an X and Y field, so we could actually check real quick. It might actually give us some information on that. So if we go to File, Question. And the CSV file, there we go, with address or latitude, longitude, and comma, semicolon, or tab delimited. So I have not tried this, but it sounds to me like you can just have a Excel file with address as one field, and then your address is underneath it. It can be, probably put it all in one line, so street plus city plus state, and then add you can add whatever other attributes you want in the columns in Excel, save it as a CSV, and then you can upload it. I think that's it.
Well, I would certainly like to thank Janine Herrick and Matt Simon of the North Carolina Institute of Public Health, plus their team, who has done a fabulous project for us here at the endowment, and really appreciate their expertise and time today. So thank you very much. And thank you all for attending.